Hello, my name is Fiona Bengo and welcome to the Maven Manor training. I'm going to train you about some of the things to do with healthcare improvement, and we'll head right away to the outline. So in the outline, the first thing that we are going to talk about is the purpose and benefits of healthcare licensure. And then we'll go to the purpose and benefits of healthcare accreditation. And then we'll find out some of the major differences between licensure and accreditation in healthcare. Then we'll go to some of the organizations, which includes the Joint Commission, National Committee for Quality Assurance, NCQA, the Health and Medicine Division, HMD, Agency for Healthcare Research and Quality, AHRQ, Centers for Medicare and Medicaid Services, CMS. Then we'll go to some of the reports and initiatives, in which they include IOM, To Err is Human, and then another report written by IOM, Crossing the Quantity Chasm. And then we'll go to the National Strategy for Quality Improvement in Healthcare. We'll head to the Nursing Home Quality Initiative. And then more, if you want to find more details, you'll go to the references. On this slide, I'm going to talk about the purpose and benefits of healthcare licensure. So before talking about the purpose and its benefit, so you might ask yourself, what is the meaning of licensure? So licensure is the process by which a governmental authority grants permission to an individual practitioner or healthcare organization to operate or to engage in occupational profession. So just looking from the definition of licensure, so we'll head to the purpose and benefit. So the purpose of healthcare licensure is that it protects basic public health and safety. So for the benefits, we have a couple of benefits here. So the first one is that it ensures that the organization has the essential components required to provide care to patients. Secondly, it also minimizes risk to health and safety. On our next slide, we are going to talk about the purpose and benefits of healthcare accreditation. So also here, I'm going to explain what accreditation means. So accreditation is the formal process by which a recognized body, usually a non-governmental organization, assesses and recognizes that a healthcare organization meets applicable, predetermined and published standards. So for the purpose of healthcare accreditation, we have that it improves quality of healthcare, it stimulates and improves integration and management of health services. The third purpose is that it reduces healthcare costs. And fourthly, it strengthens the public's confidence in the quality of healthcare. So let's go to the benefits of healthcare accreditation. So the first benefit is that it boosts patients' safety efforts. Secondly, it improves risk reduction. And thirdly, provides education to improve healthcare operations. Fourth, it enhances staff recruitment and development. So the fifth is that it provides professional advice to staffs. So that was it about the purpose and benefits of healthcare accreditation. On this slide, I'm going to be talking about the major differences between licensure and accreditation in healthcare. So as you've seen, there are different things. That's why obviously they must have some major differences. So let me go and start with the licensure. So licensure has some differences from accreditation. So the first difference of licensure is that it is based on minimal legal requirement for one to access it. So this means that you can, if you have few legal formalities, you can be able to access it. So the second difference is that licensure is mandatory. This means that for any healthcare organization, you must have this in order for you to start running your healthcare organization. There's no option for you to choose not to have it because it's a must for each organization to have it. So the third differences of licensure is that licensure requirements change from year to year. So it changes from year to year, but the changes are very few. So they don't change it a lot, but if they need to add something small, that's when they change it. And they normally look on it every year. So let us move on to the accreditation differences. So the first difference of accreditation is that this one is based on a demonstration of special knowledge and capability for one to access it. This means that you need to show something unique that you have, or your organization has to show something unique. That's when it can be able to get the accreditation. So it's not all about having minimal legal requirements as licensor, but it's all about having a unique thing that you did or you're going to do for you to access it. So the second difference is that accreditation is voluntary. This means that you can either choose to have it or not to have it. So it's not a must like the licensor. So for accreditation, you can choose to have it. So the third and the last difference is that accreditation is normally revised periodically. So this means that every time in periods, they normally change accreditation requirements. So, and the requirements change at a greater fact because they want to stay with the current situations. So that's why they normally change it. They normally change it periodically so that they can have, they can be with the current situation. So that was it about the major differences between licensure and accreditation. Thank you. So in this particular slide, I'm going to talk about the national organization and initiatives that promote quality improvement in healthcare. So in order to improve healthcare, we need some organizations to coordinate that. So let's start with the Joint Commission. So the as you can see, this photo shows the gold seal in which when an organization, a healthcare organization has fulfilled something, that's when they get this golden badge. So the Joint Commission was founded in the year 1951. So as you can see, it started very early. It's not something that started very recently here. So the mission of this organization is that they help in improving the healthcare for the public through evaluating healthcare organizations. So their work is to evaluate and criticize healthcare organizations in order for them to make the healthcare of the public better. So let's move on to the purpose of the Joint Commission. So the purpose of the Joint Commission is to evaluate and accredit healthcare organizations in the United States. So as we talk about accreditation, they give it to organizations that bring out a unique fact from them. So after this Joint Commission sees that there is a unique thing about a healthcare organization, that's when they give it the accreditation. So let's move on to the key initiatives that they normally do. So the first key initiative that they do is accreditation services, as I've just talked about it. The second thing is certification services. Thirdly, we have setting quality standards. So they're the ones who set the standards required for the healthcare organizations. So the fourth one is evaluating organization performance. In this, they can go to the organization and conduct field research in order for them to find out more about the organization and be able to evaluate it. And lastly, they are there to transform healthcare. Actually, that is the main purpose and the key initiative of this joint commission. So that was it for the joint commission. So in this slide, I'm going to focus on the second organization that promotes quality improvement in healthcare. It's called NCQA. So NCQA in full is National Committee for Quality Assurance. So this one began in the early 1990s by measuring and then accrediting health plans. So it's been there for long, but not as much as the Joint Commission that we talked about it much earlier. So this is the logo for NCQA. So when you go to their building, this is what you will find. So the mission of National Committee for Quality Assurance is that it improves the quality of healthcare. And the purpose for this is that gives a guide to healthcare that science says works. So after something has been scientifically proven, that's when they give them to healthcare organization in which it will act as a guide for them. So the second purpose is that it studies how well health plans and healthcare professionals provide scientifically proven care. They do this by visiting healthcare organizations and doing research on them to evaluate how they normally use scientifically proven care. So when they find that it's working in that organization, they put it a tick. They say that that organization is fully doing what has been scientifically proven. So the third purpose is that they help in identifying organizations that improve healthcare. So for this, as I've said, they do research and they go on to each organization to check which one is improving healthcare. If they find that the organization is improving healthcare, so they might accredit it or even give it a licensor. So let's move to the key initiatives. So they are involved in the HADES. This means Healthcare Effectiveness Data and Information Set. So this is where they look at the data that they have in order for them to see if the healthcare is working. So the second initiative is Health Plan Accreditation. This is where they form the plan on how to accredit healthcare organization. We have the PCMH recognition, in which it means that patient-centered medical home, and it has been found out that more than 30,000 practice sites and 67,000 clinicians have earned the NCQA PCMH. You can see that they are doing a good job in trying to improve the healthcare of people. And also, it has Quality Solutions Group. So this group, they are being formed in order to find solutions that can benefit a lot of people. So this group has very much improved healthcare, and you can see that NCQA is doing good work. So that was it about National Committee for Quality Assurance. In this slide, I'm going to talk about the third organization, which is called HMD, Health and Medicine Division. So let's move on to the mission, in which its mission is making a difference. And you might ask yourself, how do they make make a difference in healthcare? So the purpose can enable us to understand how they make a difference in healthcare. So their purpose is that they provide evidence which helps both government and private sector make informed health decisions. So for them to make a difference, they bring out evidences which have been scientifically proven to work in order for the government and private sector to get informed health decisions, because the government and the private sector have to be involved in order for them to improve the healthcare. So some of the key initiatives are food and drug regulatory systems. They have this one in order to regulate the drug usage and the right food to be used. So they also assess the available scientific data. So when scientifically proven data has been brought up, they are the ones to assess it by evaluating and criticizing it in order to say if it is good. The other key initiative is they address sickle cell disease. As you know, this disease kills many people, and now they address it by finding ways in order to solve that problem. So the other key initiative is that health systems, they provide health system intervention to prevent firearm injuries and death. Firearm injuries, they might occur from guns and bombs. So they bring out health system intervention in order to solve this problem. So that was it about health and medicine division. So the fourth organization is called the AHRQ. In full, it is Agency for Healthcare Research and Quality. So first of all, let me give you an insight. So this is the lead federal agency charged with improving the safety and quality of America's healthcare system. So it's on the good side that this one, it's on the lead because it's really helping the Americans in their healthcare. So this is their logo, and this is how it looks like. So their mission is that they provide evidences to make healthcare better by making sure that different stakeholders understand and use the evidences produced. So for them, they provide evidences which have been scientifically proven to work to some of the healthcare organizations in order for them to use them and be able to satisfy the needs of America through healthcare. So that was the mission. Let's move on to the purpose. So the first purpose is that they create materials to teach and train healthcare systems. So they go and they find out some of the materials which can help healthcare systems in order for them to use them in delivering good healthcare. So the second purpose is that they invest in research on the national health delivery systems. So as in their mission, they provide evidences, so they have to invest in research for those people who do research in order for them to bring out good evidences. So the third purpose is that they generate measures and data used by providers and policymakers. That is another purpose. So let's move to the key initiatives. So we have the AHRQ quality indicators. So they have these indicators for them to measure whether healthcare is of quality or not. So the other key initiative is consumer assessment of healthcare providers and systems. And the third key initiative is MONAHRQ. So that was it about the AHRQ, and thank you. So on this slide, I'm going to talk about another initiative, which is called CMS, Centers for Medicare and Medicaid Services. So this organization has a lot of professionals with diverse background. This means that they don't consider professionals from the same backgrounds, but they consider professionals from different diverse backgrounds. So let's move on to their mission. So you might ask yourself, what is their mission? So their mission is to ensure that the ones they represent are recognized in the agency as it is developing. So when their agency, this CMS, are developed, they make sure that those represented are developing with them and they are being recognized. So they can be the public or they can be healthcare organizations. So as it grows, so also the people who are represented, they must be recognized. So let's move on to the purpose. Sorry. So the first purpose is that they ensure that minority health interests are represented. So this means that they really represent the minority people. So that is a good thing to do. So the second purpose is that the principal advisor to the agency on the needs of minority populations. So they are the ones who give advices uh, to the agencies on the needs of minority populations. So if there is any need of minority populations, they are the ones who give those agencies. So they also monitor environmental factors and trends that may impact minority health. So I've noticed that these people are mostly working on minority people. So they consider environmental factors. It might be social, it might be maybe the place where the person is staying that might be affecting that person. So that is what they monitor mostly too. So let's move on to the key initiatives. We have MACRA of 2015, and we have Transforming Clinical Practices, that is another initiative. Post-Acute Care Reform Plan, that is another initiative, and inpatient rehabilitation facilities. So maybe if there's some people who have some problems in maybe the use of drugs or they are being traumatized, they're the ones who provide rehabilitation facilities for their inpatients. So that was it for CMS, Centers for Medicare and Medicaid Services. So in this slide, I'm going to talk about a report which was written by IOM, which stands for Institute of Medicine, which was recently changed to HMD, Health Medicine Division. So they wrote a report in order to help improve healthcare. So the report is called To Err is Human. So this was written because there were some medical errors which were occurring. So you might ask yourself, what is the meaning of medical error? So it has two meanings. Medical error has two meanings. So the first meaning is that it is the failure of a planned action to be completed as intended. So, and the second one is that it's the use of a wrong plan to achieve an aim. So when you don't have the right plan to use, you won't be able to achieve an aim. So this makes medical errors to occur. So you might ask yourself some of the examples of medical errors, in which I just picked a few. So we have improper transfusions, surgical injuries and wrong-sighted surgery, suicides, restraint-related injuries or even death, falls, burns, pressure ulcers, mistaken patient identities. So you see, these are examples of medical errors which could have been prevented. So it has been found out that at least 44,000 people and as many as 98,000 people die in hospitals each year as a result of medical errors that could have been prevented. So you see, this is a very big issue in which it should not be taken easily. So it needs to be solved. If these medical errors could have been prevented, so many people would have lived. And also, not only has it affected the lives of people, also it's taking a lot of money from the pockets of people. Like there is a research that have been done, and it has been found that they have been estimated to result in total costs of between 17 billion and 29 billion per year in hospitals nationwide. So this is America alone. So because of these medical errors, it is found that people use 17 billion and 29 billion dollars every year. So it means that these medical errors are very costly in terms of both money and also the lives of people. So actually what I'm going to focus mostly in this report is the role and the significance of this report. So you might ask yourself, what is the role of this report? So the role of this report is to break the cycle of inaction regarding medical errors by advocating a comprehensive approach to improving patient safety, to improve patient safety. So it has been found out that mostly patients are not safe in the hospital, and in which it is a very fundamental issue. So the work of this report is to help to find solutions on how to prevent those medical errors from occurring. So the significance of this report is that it offers a roadmap toward a safer health system. So they have offered some of solutions in this report, in which I think it can be able to reduce the medical errors that might occur. So this report is really being stressed on so that people can find out how they can really be able to solve this issue. So that was it about this report. But before finishing, let me just tell you, it has been found out that the majority of medical errors do not result from individual recklessness or the actions of a particular group, but more commonly, errors are caused by faulty systems, processes, and conditions that lead people to make mistakes or fail to prevent them. So it is not all about one person who is making a mistake or a group of individuals who are making mistakes, but it's all about the processes that are being used and the healthcare systems. All the systems that are being used, all the processes are the ones which mostly cause medical errors. So that is what I found about this report. And if people can be able to look into this issue, I think this problem can be able to be solved. So that was it about this report, and thank you so much for your attention. So in this slide, I'm going to talk about another report in which it's called Crossing the Quality Chasm. So as we know, the chasm means something which is wide open. It is even much worse than a gap. So this one was created because some American healthcare deliverers saw that the healthcare needs a fundamental change. So stakeholders were concerned that the care delivered is not essentially the care they should receive. That's why they needed a change. So I'm going to focus on the role and significance of the report. So the role is that it's a call for action to improve the American healthcare delivery system as a whole. They mean that they not only want to focus on one thing, but they want to focus on each and every part of healthcare in order to improve it. So let's move on to the significance. So its significance is that it is offering a strategy and action plan for building a stronger healthcare system over the coming decade. So this report is very important as it has given out some action plan which can be used to solve problems in the healthcare. So they have established 6 aims in healthcare system for the 21st century. So the healthcare system has to be safe, it has to be effective, it has to be patient-centered, it has to be timely, it has to be efficient, and it has to be equitable. So as you've seen those aims, so that was the main aim of these. So on this slide, I'm going to talk about an initiative which was started by AHRQ, which is called National Strategy for Quality Improvement in Healthcare. So what they need, what they have made is a national quality strategy in order for them to solve problems in healthcare. So let's move on to the role. So one of the roles is that it improves the overall quality of healthcare. The second one is that it improves the health of the US population. So the third is that it reduces the cost of quality healthcare, because sometimes healthcare can be very expensive, so they help in reducing that price. So that was it about the roles. Let's move to the significance. So it is making care safe. Secondly, it is ensuring that each person engages in their care. So it doesn't matter whether you are a doctor, whether you are a patient, you must be able to engage in your care. So the third is that it works with the communities to promote the best practices to enhance healthcare living. So that is what they do. And then the fourth one is that they promote effective communication and coordination of care. They involve each and every stakeholder who are involved in healthcare organizations. So that was it about the national strategies for quality improvement in healthcare. So on this slide, I'm going to talk about the last initiative, which was made by CMS. It's called Nursing Home Quality Initiative. So I'm going to focus on the roles and significance again. So one of the roles of Nursing Home Quality Initiative is that it gives information about the quality of care, as it's focusing on nursing home, so it gives information about the quality of care in nursing homes. So the second role is that it gives information about the care at nursing homes. And the third is that it facilitates your discussion with nursing home staff regarding the quality of care. So it makes sure that it connects you with the people who are in the nursing home, so that you can get the quality care. So it also gives data to the nursing home. So after they've done research, that's when they come and they give data to that nursing home. So let's move on to the significance. So their main significance is that they've been able to show ways in which nursing homes are different from one another. So after conducting such researches, they've been able to find out different nursing homes and how they are contrasting each other. So that was it about the Nursing Home Quality Initiative, and it's really helpful to nursing homes. So in this slide, I'm going to talk about the Nursing Home Compare 5-star rating. So this tool is used by the Nursing Home Quality Initiative in order to differentiate different nursing homes and be able to know which one is the best. So as you can see, the picture below shows the Heritage Healthcare and Rehabilitation Center, which is found in Naples. So they are showing the 5-star rating. So the overall rating shows that this nursing home, it's above average. So you might ask yourself what they use to be able to rate this nursing home. So the criteria that they use in order for them to evaluate the nursing home has 3 parts. So we have the first one, which is health inspections. The second is quality of resident care measures, and the third is staffing. So when they use this method, they are able to figure out which one is the best and which one they can be able to recommend people to go to. The nursing home that they can recommend people to go to receive better health care. So this is very helpful for them, and it can be able to improve the discussions between their patients and the nursing homes. So I can see we are coming at the end of the presentation, and I would just like you to leave here with only 3 things. I know I could have said a lot of things earlier, but these 3 things can really help to improve our Maven Manor nursing home. So I would just like to suggest that we should find a special skill that you can demonstrate so that we can be able to get the accreditation easily. As I had said earlier, that accreditation is given to those people who do a unique, to those organizations which do a unique thing, and which can improve the health of people. So when we do this special thing, we can be able to get this accreditation for sure. And also, as very soon we are having an upcoming accreditation survey, we should first rate ourselves using the 5-star rating so that you can really find out at what stage we are. Through doing this, we'll be able to, it will help us to improve on areas that we are still lagging behind with, and also continue using the best methods that we have to improve our nursing home. And I'm sure by doing this, we can be able to gain a lot of things and be able to get the accreditation. So thank you. So this is the reference list, and in the reference list I've just provided them in order for you to get much more information, so that when you want to learn more about what I've already talked about, you can be able to get information from these articles. So this will help you a lot. You can be able to get them from these references. So this is the continuation of that reference. And also it continues the references. There are so many information that I got from online. So if you need more of them, you can just go through these references. Help you a lot. So as you can see, it's still continuing. So the references are there to help you to find out more about those information that I gave earlier. So I think we are at the conclusion, and I would like to thank you for your attention. It was so much pleasure to train you about how some of the healthcare organization helps to improve healthcare systems. So it was a pleasure, and if you have any questions, feel free to reach out to me after. Thank you so much again.